Hello, dear friends. My name is Maria Reznikova, and this is a translation of the webinar of Lyubov Balabanova, doctor, candidate of medicine, doctor of psychology, professor of psychology at the National Civil Defense University of Ukraine. We're happy to welcome everyone who's interested in health questions because today we will talk about stress. Today, even the most reliable mechanism breaks down after excessive work, and human mental health is not an exception. We try to keep up with today's standards, and often we feel stress. Many people wonder what it is. Stress is a long-term system, psychological and hormonal reaction of the organism to life situations, which a person considers threatening for his well-being and does not see any opportunities for their quick resolution. The term stress was introduced by Hans Selye in 1936 when he put forth a concept of biological stress. In 1975, he introduced the term psychological stress, and the research showed that different unfavorable factors as fatigue, fear, grievance cause one type non-specific reaction in the organism. What's more, these irritants not necessarily have to exist in real life. A person reacts to danger or reminder of this situation. In most situations, stress has several stages. First stage is anxiety. It is a mobilization of energy resources in the organism. It is a moderate stress. It can be even favorable. Stress at this stage is called eustress, and it's favorable because it leads to increase of resources, working capacity, and mobilization of the organism. The second stage is a resistance stage or adaptation stage. When there happens a balanced expenditure of resources in the organism. Externally, everything looks normal. A person solves tasks, but if this stage lasts for too long and is not accompanied by rest, then the organism works flat out. Precisely at this stage, there are formed various psychosomatic disorders and neurotic states. The third stage is an exhaustion stage or a distress stage. At this stage, a person feels weakness, working capacity decreases, sharply increases risk of disease. Besides, stress can be of different severity. Central launching mechanism of activation of stress reaction is at the hypothalamus or limbic or emotional system level. Dysfunction in the organism starts developing according to certain schemes. And the psychological and the physiological component of these schemes are both gallbladder spasm or left kidney spasm. This is a preparation of the organism for a certain type of activity. In the wild, victims freeze to become invisible. They are preparing for an action both for fight or attack or for protection or escape. And in this first case, when the gallbladder is in spasm, there appears need to stop the digestion process. And this is accompanied by gallbladder spasm. Gallbladder spasm is a first physiological reaction of the majority of people to stress. This is a protection reaction. The body starts shrinking, aiming to become invisible to the fetal position. If this reaction to stress is repeated, then there comes the habituation, and the person reacts to stress with habitual stereotype. As a result, there are formed such non-adaptive adaptation habits. There appear psychosomatic disorders. One of the manifestations is round shoulders. Muscles of the anterior surface of the torso are in spasm. Everyone thinks that round shoulders have people who sit wrong, but in fact, round shoulders is a manifestation of stress reaction when a person closes up, shrinks to close his feelings. The same way the psychosomatic disorders are developed when a person has a fear of fail, he also shrinks. And these shrunk muscles lead to impotency, hemorrhoids development, to blood shunting, and usually people turn to neuro specialists to solve their problems. In the second case, the reaction is manifested by a subjective feeling of anxiety. It causes different reaction in the body. When a person must go to work, must, all the time must, he has to do something all the time. He has to go somewhere all the time. So it leads to spasm of back muscles, especially of lower back. Sometimes there can be back pain. Blood circulation gets disturbed, and this is a launching mechanism of spinal disc herniation development. There disturbs the blood supply of spinal discs. This reaction involves into the process the activation of left kidney functions. Left kidney replies for regulation of acid-base balance. This pathologic chain then spreads to adrenal glands, and when they increase their functional activity, then there disturbs the mineral turnover. There suffer joints of upper and lower extremities. The cardiovascular system suffers. The blood pressure is elevated, and this is also a reaction which is launched by stress impacts. Impulses in response to stress impact come to brain, to hypothalamus, and stimulate the secretion of such hormone called adrenocorticotropic hormone, a hormone which activates the activity of adrenal cortex and beta endorphin. These substances impact the adrenal cortex, stimulate the production of glucocorticoids, mainly cortisol and adrenaline. These hormones are considered stress hormones, and they lead to spasm skeletal muscles, vessels, and blood pressure elevation, to rapid breathing, etc. In response to stress stimulus, there turns on the whole body as the most complicated system. With stress, there are disturbed central nervous system and positive emotion center. This is connected to the deterioration of psycho-emotional state. Then the immunity system gets involved, and cell immunity suffers, which impacts the WBC differential. In the endocrine system, at first suffers the thyroid gland and epiphysis. Thyroid gland replies for the embedding of a person into the surrounding world and his realization in this world, and the energy exchange gets disturbed. So today it is spread wider than a usual cold. About 90% of citizens at least once faced stress manifestations. It is told that now there is a widespread stressing of population. But it is hard to gather the statistics since many people prefer to bear life commotions, not paying attention to stress until they appear at the doctors with serious problems. And the danger of stress in modern world is enormous. Almost every person is at some risk group. And mostly people who are vulnerable to stress are people with anxious personality type. These people often worry about something that hasn't happened yet. They constantly blame themselves for past mistakes. They make up different situations with slightest uncomfortable states. Work addicts are also vulnerable to stress. These people think that if they don't work, something bad will happen. Like this, they compensate their anxiety by constantly staying at the workplace. People with relationship problems with friends, family members, colleagues, and just relationship with the surrounding world also get stress. People who abuse alcohol, smoke, take drugs. The reality is that by this, Many people try to dull negative emotions. Besides, people who have low self-esteem are also impacted by stress. Extra responsible people or people with excellent student complex can also have distress loads. Constantly being in a perfectionism state, wishing to be perfect in everything also leads to having stress. Besides, people who are planning serious change in life or have just gone through them, what kind of change? It doesn't matter if they were positive or negative. With positive change, there also appear stress reactions. The risk group includes people who have recently gone through loss, which lost a significant other. Young families who need to get used to each other, moving to another place, job promotion when you have to correspond to these career expectations. Besides all the people who suffer from severe pathologies as liver diseases, thyroid gland disease, oncology, people who have a significant other with oncology, or people who suffer from oncology, all of them are in the state of stress. Stress is not a specific reaction, but there are general signs that are manifested in many people who suffer from stress. And these general non-specific signs can be both from our physical side and our emotions. They can be manifested in our behavior and in our cognitive functions. From the part of the body, there develop headaches, decreased immunity, even visiting a dentist can be stressful for many people. The body reacts to stress with muscle tension, and this muscle tension becomes chronic. There is pain in shoulders, interscapular region, the muscles are spasmed, the blood circulation gets disturbed, a person has headaches, fatigue, etc. Skin also reacts. Breathlessness appears. From the part of emotions, a person becomes irritable, there can appear reactions of anger, anxiousness, a person loses trust and becomes very suspicious. There appear a lot of complaints towards the closest people. From the part of cognitive functions, there appears confusion of thoughts. A person can't focus, has nightmares, becomes indecisive, is in a bad mood. A person can't make right decisions. And of course, it is manifested on the behavior level. People try to eat the stress. They are either overeat or eat not enough. In both cases, the eating behavior suffers. Sexual desire also decreases. We met people who, during the bad crisis in their countries, couldn't even eat and would throw up even seeing food. Physiological consequences of stress appear sooner than psychological. They make people doubt whether everything is okay, since we're not used to pay attention to our state of mind. But when there are some health problems, it's another story. And a person goes to a doctor, especially when stress is accompanied by headaches, short breathing, dizziness. The very characteristic sign is a feeling of lump in the throat. Digestion disorder, pressure drops. Then a person goes to a doctor, not even thinking that a source of these problems is stress. There is a simple signal indicator based on the results of white blood ratio. For acute stress, leukocytosis is characteristic when the general number of leukocytes is increased. For acute stress, there is also characteristic absence of eosinophils and decrease of the relative number of lymphocytes. With chronic stress, there is only one side, decrease of percentage of lymphocytes in the leukogram. As a rule, less than 20%. There is a very simple way to estimate the level of stress. There are 10 criteria, 10 points that you need to estimate from -3, the worst index, to +3, the best index. These points are anxiousness, irritability, fatigability, oppression, time of working capacity, speed of working capacity, how fast can a person work, appetite, sleep, optimism, activeness. You need to quickly, without thinking, estimate the level of each point. It's a very easy way to identify the state of stress. The more severe stress is, the lower are the points. Especially it is applied to four indicators: anxiousness, oppression, optimism, and activeness. As a rule, stress is a reactive state. In other words, it appears due to external situations and circumstances. When the Chernobyl disaster happened in the countries of Ukraine and Belarus, there was noted a common reaction, decrease of reactivity. It means that the organism stopped to adequately react to situation of the outside environment. There appears a deficiency of positive emotions, unsatisfaction of needs, failure of plans, or on the contrary, a person has oversupply of information. As a consequence, there appears emotional exhaustion, and a person starts to exaggerate current problems. There can be different after effects of stress, which cause a person to have cold-related diseases more often, or chronic diseases are aggravated. Stress impacts appearance. The stress impacts appearance as well. Firstly, our skin reacts. As a consequence of severe physical exertion of the cardiovascular system, gastrointestinal tract, endocrine system become very sensitive. Stress also does serious damage to mental state, and being in such state for a long term leads to depressive disorders. Non-productive ways to fight stress are drinking alcohol, overeating, working frustration off on the significant others. Stress impact can be manifested not immediately. Very often it has a postponed development of a serious disease. It is well said that the development of all the diseases, especially of oncology, are referred to psychosomatic diseases. There are simple ways to increase stress resistance. They can be divided in two approaches. The first one is preventive. When there increases the resource capacity of the organism to confront stress loads. Physical exercises help to let off steam, improve mood, improve work of the cardiovascular system. The serotonin increases. It's a hormone needed for a correct work of the brain, so sleep also improves. Such resource method is relaxation techniques, which allow to reduce muscle tension, which allow to relax and get rid of compulsive thoughts. Such methods are meditation, yoga, massages, aromatherapy, psychotherapy. Group or individual sessions allow to work up a correct reaction in stress situations, to change attitude towards yourself, life circumstances, or other situations. Healthy lifestyle, how corny it may sound, really works. Since alcohol, nicotine, caffeine give excessive load on nervous system and can aggravate stress. The replenishment of vitamins and minerals can also be referred to resource methods. It can be due to a dreary diet. It can also lead to developing of unfavorable reactions of the organism to stress. If these preventive methods don't work, then there are applied so-called efficient methods when there develops stress. So how to prevent stress development? Usually people ignore the above discussed signs. They think that irritability, insomnia, low mood, constant fatigue is an inevitable thing that is proper to almost everyone, but it's not true. Stress, rather distress, is not a norm of life because chronic fatigue, forgetfulness, tearfulness, headaches, anxiety, sleep disorders are such called third state, which tell that a person is between health and disease, and the majority of people today are in this third state, not even noticing this state. A person can work, perform some actions, and this third state in which a person stays without paying attention becomes usual. But all these problems can be solved. Not paying attention to them and wait until they pass by themselves can lead to consequences. The third state is very sensitive, and even a minimal impact on a person in this moment can forward the adaptive system towards health, help a person come to another level of functioning. And if this moment is passed and a person passes into a stable state of non-health or disease, then he or she has to take much more effort to overcome these states. That's why it's important to control and prevent it, to develop the resource of the organism, to resist stress overloads. Stress does not appear from nowhere. One needs to change life, reconsider the working schedule, finish a non-prospective relationship, because many continue staying in a relationship hoping for some change or being afraid to changing life. It's necessary to learn how to communicate with people. It's a long-term process, and often people lack time and resource to follow this path. That's why there were developed different technical ways for those who want to get rid of stress, to release tension, neutralize the environment negative factors impact. And this was implemented in Biomedis company due to the development of the fourth mode in the Biomedis Trinity device, in which there were embedded anti-stress complexes aimed for harmonization of nervous system, normalization of sleep process, improving sleep quality, removing chronic fatigue, improving general well-being, and neutralizing the destructive impact of stress on human organism. Because actually the organism has some built-in protective and adaptive mechanisms aimed to restore the affected self-regulation. And the aim of such impact is to lay the background for full implementation of adaptive capacities. The programs of the fourth mode of the Trinity device are based on the method of transcranial electromagnetic stimulation. This method is well known and was effectively applied to find the psycho-emotional states in burn victims after disasters, wars, etc. Previously, the transcranial stimulation was effected in a contact method. It was necessary to visit the medical center, apply the electrodes, and stay there during the impact time. So the course was usually of 10-15 procedures. Especially it must be applied for children with the psychological development disturbances, children with hyperactivity syndrome, lack of attention, and this procedure is quite expensive. In Ukraine, it costs around $700, which is a lot for Ukraine, and not everyone can have so much time and money to have these procedures. And they are available only in big cities. Meanwhile, Biomedis company developed the non-contact way to have the same impact with the help of multi-frequency synchronization, which allows to apply the correction programs both as a prevention way to increase the adaptation reserve to protect internal organs and organism as a whole from emotional and psychosocial loads, and to optimize the adaptation reactions directly during the process of stress impacts. Besides, it can be even an effective measure in the complex therapy and rehabilitation of psychosomatic problems. There are very good results of the fourth mode application. As a rule, there happens the harmonization of alpha rhythm, actualization of processes of relaxation, restoration. They optimize the nervous processes in the brain cortex, etc. If stresses repeat, if there appear usual reactions to stress, then in the brain cortex there is developed the dominant idea. There forms a such generator of pathologically intensified excitation, which sends impulses towards cardiovascular system, gastrointestinal tract, and there occurs disorganization of psychological and physical processes. So to consciously choose the optimal behavior and correct the mental and vegetative functions, this fourth mode is like a magic wand. There are all algorithms that allow a person to apply the device by himself. The first algorithm is a basic complex used to relax and to eliminate tension. This basic complex consists of two programs. The first one is alpha rhythm program, and the second one is peace program. This is a very efficient program because it allows to activate the alpha rhythm. This is a resource state because thanks to this rhythm, a person's brain passes from the left hemisphere to the right hemisphere and starts to establish connection with its unconscious part. It improves the brain blood circulation, significantly improves the consumption of oxygen by the brain. There start processes of self-restoration and self-regulation. Usually, a person passes to this alpha rhythm. It is a range between 7.5 to 13-14 hertz when a person starts to fall asleep or when a person is waking up. This state is characterized by relaxation and intellectual tranquility. This is a feeling of pleasant tranquility. If a person came back home tired, if he had to solve different problems, had stressful situations, then he can turn on Trinity in the fourth mode, turn on the alpha rhythm program, and stay in this resource state for a while. A state when they turn on the restoration processes and launch the processes of self-regulation. Then in the range of 10 minutes to 3 hours, you can also apply the peace program to enhance the impact. This is a general strengthening program which is applied for a deep inner relaxation and stabilization of the immune system. Especially if a person has a constant anxiety, nervousness, if there are many conflict situations, or there are stress situations inside family or at school when teenagers have conflicts with the contemporaries, miscommunication with parents, etc. Besides, the peace program allows to weaken fears, to correct problems with the vegetative vascular dystonia. And it allows to weaken the psychosomatic problems related to gastritis, stomach and peptic ulcer, asthmatic states. During stress, there increases cholesterol. Also, this program allows to release tension of shoulder, girdle, and spine. Very often, a person unintentionally raises shoulders and draws head into the shoulders, not even noticing that. This reaction becomes usual. Then you can turn on this peace program. It lasts for 30 minutes, and it's very useful to knock on the interscapular region and shoulders with hand or with a wooden spoon until the feeling of warmth. Since it improves the capillary circulation and relaxes the muscles. Not pressing, but knocking this area leads to such positive result. Like this, these two basic complexes with a course of 8-10 sessions, one session a day, will allow to increase your resources to resist pathological stress or distress. And such courses can be repeated several times with the interval of a couple months. It depends on how much stress you have in life. The next complex is when there is developing a state of acute stress, when you need to strategically apply the programs. You need to quickly relieve stress and to not let the stress to enter deeper. Not to let the physiological processes launch. At first, we react psychologically, and then they turn on the physiological mechanisms. So, not to let this happen, it's important to timely correct the stress action. And there is an amazing program, Thoughts Eraser. It can be applied based on the technique of elimination of negative psychotraumatic mindsets. For example, you need to choose an unpleasant, disturbing event, concentrate on the most acute episode of this event. It can be some psychotraumatic message. For example, you heard that someone has an untreatable disease, or someone died, or you're going through divorce, or you concentrate on some unpleasant action. So you turn on the Thoughts Eraser program in the fourth mode, you close your eyes, enter the atmosphere of this traumatic event, and start the practice. The practice lies in the multiple repetition out loud or in your mind of the same offensive words or traumatic phrases, or to multiply experience the psychotraumatic event. Recently, we had a case when a patient had a fight with her husband. She came home and he was drunk. After the fight, she went to bed and she wakes up to seeing her husband staying above her with a stick and he says, "I will kill you." She was so scared, she had a spasm in the area of the solar plexus and stomach, and she came to us with a complaint of this discomfort. We turned on this program and she was sitting and repeating, I'll kill you," in her mind. And gradually the spasm went away and the acuteness of these feelings went away. And during half an hour, she noted that her stomach area was relaxed. So it's very important in the moment when you tell these phrases to give yourself a freedom of emotional reaction. If you need to cry, just cry. If you want to scream or swear, you have to let these emotions outside. Because very often we try to behave ourselves. We push these emotions inside our body, and then the body starts to react to these unreacted emotions. So it's very important to give yourself to react. You need to be okay with the unpleasant senses, which can occur like pressure in temples, itchy throat. But as far as this negative program weakens, usually from 20 minutes to 1 hour, these unpleasant senses disappear, and there comes freshness, energy surge, a feeling of confidence. You have energy, the body relaxes, and you feel lightness. With the severe stress, this practice can be repeated several times until stress is relieved. Like this, you don't allow to be involved into this stress reaction. If you have a chronic stress, then there develop the pathological manifestations of stress. So to the basic complex alpha rhythm and peace program, there is added the stress program 1. This program is aimed at elimination of psychological blocks, to set free these unreacted emotions, to set the patient free from this pathological spiral, stress, disease, stress. Some people, not even being recovered, have stress reactions and get sick again. This program, Stress 1, is also applied when there are psychosomatic disorders, when there are situationally conditioned neurotic reactions, when there are such syndromes as incontinence of urine, tics, logoneurosis, fears, anxiety, nervousness. This program effectively solves these problems. For example, after a conflict situation, you turn on 2 programs in a row. Alpha Rhythm and Peace program with an interval of 10 minutes. And in the evening, you can apply Stress 1 program. Also, you can evenly distribute the programs during the day. For example, Alpha Rhythm in the morning, Peace program in the afternoon, and Stress 1 in the evening. The course is usually 8-10 sessions, 1 session a day. And if needed, it can be repeated in a month. And you can repeat the courses until you achieve a comfortable state. Very often, on the background of stress events or other uncomfortable states to this basic complex, there is added the anesthesia program. When you have a headache related to stress or other comfortable states caused by stress, then you apply this program. Because you have unpleasant senses in the regions of heart, stomach, intestine, then during the day, you also turn on this program to reach pain relief. Very often, on the background of stress, there manifest the acute conditions of allergies, neurodermite, bronchial asthma, and headache as well. And then to the basic complex, alpha rhythm and peace, there is added the stress program too. This program has a specific impact on the regulation of immunological state of a patient. Because we've been saying that the mechanisms of stress are closely related to the immune system. Stress leads to a steady shift of hormone balance and constant oppression of immune system. And the consequence is not only immunosuppressive diseases, but also autoaggressive diseases. So this program is indicated for treatment of different degenerative diseases related to immune system. With allergies, with lymphatic diathesis, to increase the body defenses, with stress, conflict situations, with situationally conditioned neurotic reactions, especially neurotic reaction in children and teenagers. For example, irritability, tearfulness, emotional liability, dizziness. There can be consequences after neuroinfections, vegetative vascular dystonia, etc. This program can be applied once or twice during the day and can be applied in the courses of 8-10 sessions and repeated in a month. If on the background of stress there appear disorders of endocrine regulation, then to the basic complex there is added the stress 3 program. So this is also the main complex that is applied to treat disorders of endocrine regulation caused by stress situations. It is applied with such diseases as allergosis, eczema, sinusopathy, when there is a swelling of the nasal passages, schizoid neuroses, with migraines, with menstrual disorders, with primary amenorrhea, with um, with menstrual disorders in teenagers, it is also very common. And if a girl visits a gynecologist, they usually prescribe hormonal correction, which is not effective since it does not remove the source of the problem. And very often the source is a reaction of a girl to stress. This program is applied with endocrine disorders and hormonal vegetative syndromes such as anorexia nervosa or bulimia. Stress program 3 is also applied to basic complex and can be applied in courses in a month. Spastic states on the background of stress when a patient has different shooting pains, then there is added the stress program 4. This program helps with spasms, shooting pains. It helps relieve these spasms. Also, an indication is spastic pains in shoulders, in the nape, umbilical colics in children. Very often, stress in children is manifested with shooting pains around umbilicus. Spastic state of small intestine. This is a physiological reaction of a baby to stress. The umbilical colics are removed with the stress program 4, and with rapid heartbeat, pressure jumps, other spastic states. The only contraindication is tumor diseases. The duration of this program is 30 minutes. It can be applied once or twice during the day with courses of 8-10 sessions and can be repeated in a month to fix the corrective impact of the Biomedis Trinity device. Of course, here are some general recommendations. You can see on this slide. So the time interval between application of the programs, algorithm and piece program, is from 10 minutes to 3 hours. It's very important. And of course, the course can be of 8 to 10 sessions, one session a day. So of course, more research will be carried out, and you can yourself accumulate experience in correcting some states, and you can share your results with us. This is an amazing technology helps to deal with the troubles, stresses, to increase the resource, and to feel that life is amazing. So we wish you all the best. We wish you to enjoy life and feel that life is a precious gift. Thank you very much for your attention.